Okay, so today's is really about, I thought, the needs assessment. We'll review what we were supposed to have done, but we need to start, um, you know, building the business solution, if you like. And it starts with the needs assessment. And in order for us to build that needs assessment, we need to have a proof of concept prototype designed. And then we use that to collect data, which we use for a needs analysis. So the data we collect is really the needs assessment process, but then we need to do a needs analysis. With that needs analysis, we'll now have or produce a report that will explain with evidence that we have a value proposition. That's really what this is about. So we need to have, of course, a proof of concept prototype for the purpose of data collection. The data collection exercise is the needs assessment, which is followed by what we call a needs analysis, which is the report that supports the prototype data collection by way of explaining the value proposition. The value proposition is fairly straightforward. All we're saying is that these users who are victims, they have a need, and that need can be solved using reports or a reporting system. And there are, you can say, um, let's call them investors, who are interested in paying for that process to happen. And it's not just investors. We could argue that they are stakeholders. So investors, service providers, and you can say government. So they are all interested in the outcomes of that solution. So that's really our value proposition. Now we have to prove this, and using the prototype, we can run, you know, what we can say are a needs assessment and validation tests to show that this solution, based on this problem, which is, you know, the problem of the problem would be the inability to report abuse or domestic violence, the inability to do it. So the solution, which is the ability to do it using the system, supports each other. And then we have a stakeholder environment that are willing to support this solution. That's our value proposition. So the proof of concept is proving that that is the case with data. So we have to collect the data, we have to analyze the data, and then produce a report that will go together. And that forms our first prototype, the one that they were saying they wanted as a first prototype. But we'll proceed and produce prototypes. But this is the first one. Once we're done with this, then we can do the next, and they'll positively reinforce each other. So that's what I thought we should meet about to get that ball rolling. But of course, before we get into it, let's just review what there was some stuff we were supposed to have done. I'm not sure if you were able to do them. Were you able to make progress with the legal stuff?
No,
Okay.
honestly, since Troy has been sick, I've just been trying to catch up on so many things. And then I became sick.
Which sickness was the one? The one for Troy is the one of his broken when he hurt himself and you had to rush to hospital. That one.
Yeah, I've been,
Hmm.
he's like now he's become like a child. So you have to
Oh,
dress him, wash him.
sure. Okay. Only about
So
it.
by
How's
the
he
time
doing?
I take him to school, by the time I'm Nini,
Yeah.
and then I also had another proposal to write.
Yeah. I saw that one. Yeah.
Yeah, but then I also became sick. So with the sickness,
Yeah.
I just stopped everything. The only thing I could do was write that proposal.
Oh, I see. Okay.
Yeah, so the legal stuff,
Hmm.
I think I will call those people because there's a way I want to change.
Yeah.
You told me to change it from to a social enterprise or something like that.
Yeah.
Rather, you gave me the suggestion and then I picked the social.
Yes.
So I will have to call them
Right.
to call e-citizen
Yeah.
and ask if they can change for me or if it's possible. What is the procedure?
Yeah.
Yeah, and then
But I
the
also
needs
told you.
assessment.
Yeah, I also told you if you can't do it because of, like, now you see you have not been able to do it, you can also let me know and then I can see if I can help. If you're like now, if you have all these things going on, like sickness or
Ye-
responsibilities, if there are too many, I can see how to help if you let me know, then I can assist so that the project doesn't stop. You see, if we're two people, then we can help each other. You know what I mean?
Yeah, but
Mm.
I know you have a lot, and I wanted to do it fast, then
Mm.
tell you if I'm stuck, then I can ask for your help.
Yeah.
That's how I work in my head.
I thought you were stuck because of Troy, because of yourself, you got sick, and then you had this other project as well. So I'm assuming.
I wouldn't
Mm.
I wouldn't call that stuck, just delayed.
Okay.
But
Mm.
I get what you're saying.
Yeah.
It's just also I'm a bit concerned that I feel like I'm overburdening you
Well, I understand.
because you're
Yeah.
doing also.
Yeah. Yeah. I understand that also. But anyway, it's just a matter of how do you say, just trying to help each other because we're only two, and in an ideal situation, supposing that given all the cash we needed, then it becomes more ideal, and then we can employ people, and then we can work through the people we're employing. That helps to lessen the load on us. But now we have to carry more of the load, I suppose. And I'm just thinking that we'd have to figure it out as we go, but we have to trade off where we need to trade off so that the ball keeps moving. Otherwise, because of that deadline they've imposed, we may not meet that, or even ourselves, we may not. Sometimes your working gets stuck. We may not have enough time to sort out issues as they arise. That's why I'm only encouraging you. I'm not saying it negatively. I'm saying it positively. So when you see you're genuinely stuck and you know it's going to delay your side or the project or anything, it's okay. Just tell me, then I'll see what I can do. Like that one, I probably would find someone who I there are people I know in the grapevine. I'll just go and ask if they're still doing it, whether they can help us with that. But okay, it's okay for now. We can move on. I know there was that. The other thing you need to think about is, well, it's based on this. Each activity we do has a program and partnership side to it. I'll just explain in words, then I'll put it in writing, and then you'll see. But what it is this: that what we're saying, we're going to do a needs assessment exercise, and this needs assessment is based on what you have said is the need of victims of domestic violence. So there's already a need, and you've identified it. We have to prove that is a need, and that proof comes from victims of violence themselves. They'll come and tell us that, yeah, um, this is true. We have this need, and once they tell us in numbers, we can report that. Now we have evidence. You see, so that's one level of need, but that in itself is not. It doesn't defend our solution. We need a need that defends our solution. In order to defend our solution, we have to now have what we are calling, you can say, partners, or let's call them stakeholders. So stakeholders who are willing to support that need. So on one hand, we have service providers who will come in and say, yeah, we'll support this need, like legal service providers or healthcare, or it could be financial, or even NGO. But those are service providers. They'll provide services to support that need. And then the other is government who have interest. And government's interest we need to identify so that it's clear what the government interest is as far as that need is concerned and the solution. So the need we're talking about, which is the one you suggested, is that people who are victims of um, domestic violence have no real means of reporting that they're victims of domestic violence. That's the need, the need for a means of reporting. And then we're providing a solution. And we're saying we have what we can say are service providers who are willing to support that solution. And then we're saying government has interest in that solution. You see now, our proof of concept has to validate these things. That, okay, so which office in government is interested, and what exactly are they interested in being reported? What are the metrics of interest to them? You see, we have to get that. We have to get that. And then, of course, are the, you can say, partners, but let's say these are like investors or even NGOs or organizations that are willing to pay for that solution. And they're willing to pay if we package it in certain ways. Like if we give them data, they'll pay for that data. If we show them numbers, like let's say so many victims of let's say we're reporting 1,000 victims of domestic violence of this constituency of women, for example, have now reported that this has happened, and it shows an increase in reporting by, let's say, 20%. You see, if we can say something like that, you might find that there are organizations that are willing to support that just because we're reporting it positively that way. And it's because of our solution that this increment has come about. You see, there are organizations. So we call those partners because they'll put in money just to support what we're saying. So we need to test that. We have, because we can't just say it. We have to do a test, and that test is just a survey, really, where they are saying, yeah, if that's the case, we can put it under this project, or we can put it under this KPI, and we would fund it under this umbrella. You know, something which we can report. If it's UNICEF, then we're saying it of UNICEF. If it's some women's organization, we're funding it under, we're putting it under that. The more we get of those, they become evidence that the system is sustainable through the funding that comes from these organizations and anything else that we can identify. Because the service is a free service, I think. This is how we're thinking of it. But it's being funded by these organizations who are paying for this kind of activity. So that's the ecosystem we have to build. So we you see, there's that part where we have to go to government, identify an agency of government. I don't know, it could be a department in a ministry or something. I think there's a ministry of gender and something. So we get a department there. They may have projects, they may have initiatives, and we align ourselves with those initiatives if they fit into what we're saying. We have to do that. We also need to find these organizations like UNICEF or, let's say, women's organizations, women support um, groups, things like those. And we align their initiatives and activities with what we are saying we're doing. You see, once we align like that, there'll be people who be interested in either buying the data or funding the activity. So we go like that. And it doesn't have to be women. We might find men also. We might find boys. We might find children or girls even. But we might find different organizations that are interested in domestic violence of different kinds, and they're willing to align with our activity as long as it's able to tell them it. There'll be a there'll be an increase in reporting, and this is a positive thing. So that we need to get in this first prototyping, so that we have a value proposition. So that's one aspect of what you need to work out, so that on your side you have a clarity of the partners who are funding, the ones who bring in money. As always, we call them partners, and then you have a clarity of the you can say social impact organizations that we're working through. These are healthcare, like hospitals. It could be um, police. It could be lawyers. But there'll be social impact organizations, even the NGOs. We need to have a list of them and exactly what services they'll be providing, so that they are part of the solution. So you need to identify. So we have them, their contacts, their contact people, their addresses, and then their issues that they're willing to support that aligns itself with our solution. And our solution is very specific. It's just a reporting mechanism. That's all. So if they have something that will support our reporting mechanism, then that should be on our list of, you can say, service providers or our list of partners. So that is now something to target for next time, for example, to try and have those lists worked out in a way that we can put them down in a report. You know what I'm saying? Yeah. Yeah, Jackie, you're still there?
Yes, I'm writing down notes.
Okay. Okay. I'll also do minutes on this one. All right. Then the other thing is that now on the technical side, we need to build up. You know, we need to build the prototype that we used for the actual experiment. That's what we need to do. So I'll share with you a bit of that, just on how it starts. And this prototype is used for an exercise of data collection called needs assessment, where we're assessing the needs. And then it feeds into what we call needs analysis. And that needs analysis is now the one where we write the report. That's a needs analysis report. So, so I'll show you how it starts, so that we have the relevant information in order for us to build the prototype for the purpose of doing the actual experiment. Once we do the experiment, we're doing it with victims. This experiment at this stage is done with victims. Just give me a moment. So this stage, the experimentation, this first one, is with the victims themselves. It's not with the other stakeholders. It's the end users. So that's the first experiment, and then we'll do another one which involves service providers. But that's the second one. Okay, and we'll discuss it more in detail when we're doing it. But for now, I want to share with you something on how we build a design of a needs assessment form or layout for the purpose of an experiment for data collection from victims of uh, it's victims of domestic violence. I'll show you that. Okay. Um, yeah, that's for today. So that's what we want to plan for today. Um, if you're okay, I can share my screen. I'll share my screen from here.
Okay.
Yeah. Yeah, Nicholas, just close the door and then do things quietly. I'm sharing now. Can you see that, Jackie? You able to see?
Yes.
Okay. So this is now what I'm calling the needs assessment. We're doing a proof of concept prototype design, but this is just the stage. We have like 6 stages, but this is stage one. So what we want to do is to build a proof of concept prototype, and the target users are survivors of abuse, NGOs, social impact service providers, investors, and policymakers. However, actually, I should limit this one down to um, just the first one, survivors of abuse, because this proof of concept is targeting them. That's where the value proposition is made. But of course, it's aligned to the others. We'll discuss the alignment maybe in the report. So the purpose then is to collect data to inform needs analysis and assess stakeholder requirements. So this needs analysis, you see, the purpose of this is for us to write this report, the needs analysis report. And then to assess stakeholder requirements is important in the alignment. So these stakeholders are what we said is service providers and policymakers and partners. So those are three stakeholder types. Okay, so service providers is healthcare, police, legal services, financiers, NGOs, people like those. And then we have the policymakers. Those would be the government and governmental institutions like the UN type and these kind of organizations. And then, of course, comes the partners, are the people who will fund our activities. So those are the three alignments we have to make. So once we know what it is that is of interest to the target users, we then can align it to, let's just say, to our partners, because they'll fund. And But our partners are also very interested in the policymakers. So we have to align to the policymakers. And then we have to align to service providers for the solution to work. So that's the whole thing. That's really what we're doing. But we go step by step. So we're starting now with the end users. And just the alignment is enough. We'll build another prototype that will demonstrate how we are aligning. So proof of concept prototype approach, the breakdown of the objectives, we break it down into the actionable steps using user-centered goals. So when I talk of users, I'm talking of end users. These are the victims, and we have objectives already specified. So we break down those objectives into what we're calling actionable steps. These actionable steps are step 1, 2, 3, exactly what they're going to do in order to report domestic violence. So we leverage usability principles to ensure ease of use and engagement. Now, these are the two things that we're focused on because we're presupposing, but this is the needs that we're trying to find out. If it's easy to use and it's interesting or intuitive, they will use it. That's what this is saying. The ease of use is purely, something that is not feeling complicated to anyone, a non-tech person. And then engagement is the one where people feel there are many useful things they can do on our system in terms of reporting. We have to test that. I mean, I'll give you an example. Sometimes, like, let's take, for example, the Europeans. The Europeans are very autonomous and they like systems that allow them to be as autonomous as they can when expressing themselves. Africans are not as autonomous. We're much more, we believe in strong structural structures. Like there has to be a rule, there has to be a method, and we follow that. It's also how we're trained in school. So, for us, we do better when we can see clearly, click this, click that one, then we click them and then we complete the exercise. Like how you do M-Pesa payments. But the Europeans are much more autonomous. They prefer to work with systems a lot more like ChatGPT, where you go there and you type your own thing, and then the system knows what you're saying and it responds. You see, so there are cultural nuances, but we have to test to see what kind of system would work. Something that's more autonomous, allows you more freedom of expression, or one which is more strongly structured and simply allows you to customize it, but not to customize your response, but not to have all that freedom. In other words, the response is very structured and very controlled. So we have to test and see what works better. So that's really the exercise. Then focus on motivational drivers to ensure consistent interaction and long-term engagement. So with all these interactive things, we not assume, I mean, the research shows that users must be motivated to do what you want them to do, self-motivated. So when they come onto our system, the assumption we're making is that they're motivated to report abuse. If that is true, we have to test it to see that it's true that these people are motivated to report abuse. So we need to break that down so that we can capture it properly and express it as a need. And then long-term engagement speaks to long-term interaction with our system. You see, our system is not a one-time thing. You make the report, then you have to track the report, then you have to follow up. And even after that's done, there will be what we call survivors of, let's say, domestic violence. How would they interact with the system, like alumni? You see, so there are these different stages of interaction. So once you have reported, there is the follow-up, then there is the feedback, or you can say the monitoring, but the feedback, and then comes the alumni stage where you're now a survivor. So we need to be able to account for long-term engagement. This one, from a, let's say, investor's point of view, they'll ask this kind of question, is that how do we retain users? Like if we got end users who are victims, how do we retain them on the system? Or do they just go away? And it's never good when they go away because the amount of effort we need to get one user is great, but the amount of effort to keep them is not so great. If we are constantly applying a lot of effort to get users, then this system will find problems scaling naturally because we cannot retain users. So we have to have long-term engagement. And then we have to look at this, you know, gather feedback to identify core user needs and key areas for improvement. Now, this is now the needs assessment. The identify core user needs. That's the needs assessment. We're asking them, what do you need? So, okay, so that's one of the things the prototype does. It establishes what it is that they need. Is there anything you'd like to ask, Jackie? Just as I'm going along this so far, what I'm showing you.
Just finish. Maybe it will make sense when you finish.
Okay, because I want to switch gears. I had not finished this presentation, so I want to switch to a Word document that I was using to build up a presentation. Let me set it up, then I'll share my screen. Yeah, so because it's now Word, the layout is different and it's a bit more detailed. So let me just share my screen again. Yeah, I'll complete the presentation. It's just I got caught up with time, but let me share it this way. Yeah, I'll just share it from. Let me do it this way. 1 second. I'm just doing it quickly. 1 second only. Okay, I'm sharing now. Well, you can see. Okay, so if you can see, then it's good. Are you still see? Yeah.
Yes.
All right. So I had aligned these objective these uh, the prototype developed. This is the prototype design, but it starts in the design of the prototype with these. These are like guidelines on how I need to build the screens for the prototype. I can't just build them, but it starts with this. And this one speaks to the screens that users will be interacting with. So this is objective number one, but I don't have the objectives, but it's to do with enabling victims to report abuse securely and confidently. And that's, of course, that's even our main value proposition. So that's objective one. The key outcome is this one, which is increased reporting rates of abuse cases. And that's an important metric because wherever we go, that's the metric that's selling us. And then we have this one, which is sorry, sorry. Um, this one, which is the prototype format. So the user action is all this, but it's what this is saying is that we'll put there buttons or let's call them widgets like triggers to click and take them somewhere. And then we're going to have a follow-up survey. This follow-up survey is the needs assessment. This is now the data collection point based on what they had clicked on and the question we had asked. So I wanted to just go through it with you using the method that we would normally use. So we start with the initial action, which is to access the report page, of course. You just access, maybe you've logged in and everything. Then we ask you to click to report abuse. So there'll be a link there saying report abuse. You click on that. Now, this is the survey prompt. Remember, this is a needs assessment, which means it's a data collection exercise. So we ask questions. And the questions we'd ask, this is not confirmed, but I mean finalized, but it's at least the initial thoughts I had. The first question is, how was it for you, how easy was it for you to access the report page? Okay, remember one of the issues is that it should be easy. So we want to ask them how easy was it? And we'll give them maybe a scale to choose from. And did you feel the reporting process was secure and confidential? That's another issue you raised about privacy. So this is the key question we're asking as well. And then, what made you hesitate to report? Right? Again, partly based on what you were saying that there's a lot of hesitance. So we're asking so that we can now get data on what makes them hesitate. Okay. Then we move to user engagement because there are two things we look at. We look at initial action, and then we look at user engagement. And these are two things we're trying to, let's say, test within the proof of concept, the two main things. So under this one, they start filling out the report details. We ask these questions. What support or information would help you to feel more confident to submit the report? Okay, again, useful data. Where were you given enough control to decide how your information is shared? This control I'm referring to is really when people are coming in to share their information. Maybe I'm using a wrong word, but I'm really saying that they may not feel comfortable to share their information. So I'm trying to speak to, were you, I'll say it casually, but were you feeling comfortable or relaxed enough or safe enough to share your information? That's really what I'm talking about. And then this one is, was the form easy to complete? All right. And the form is the report form because they're reporting it. So I'm arguing that if it's 3 steps, just 1, 2, 3, and they've reported, that should be easy enough. But maybe it will be 6. We don't know. But we have to design it and then ask this question and then see what they say. They might say they had difficulty somewhere. And then the feedback at the end, once they're done. Did you feel empowered after submitting the report? Okay. And then, was the confirmation of your report submission clear and reassuring? Okay, so those are things which we'll ask them and we'll see. So the data to gather is going to help us. These are the analytics. Remember, this system is based or attached to some form of analytics. And one of the analytical pieces of information is to identify barriers of reporting. That's what we're trying to do. The second is to understand the ease of use and the perceived security of the system. And when I talk of security, I mean privacy. And then to track hesitations and friction points in the reporting process. Because some people get confused, so they delay. That's what we mean by hesitations. When they're hesitating, the analytics is picking up the hesitation. And then, of course, because they're delaying. And then, of course, friction points is where they may change their mind or they go back, make a different selection or something. That suggests there's some friction or something confusing. So we have to track that as well so that we know where they are. Okay, number 2 is the second objective, which is provide reporting resources for legal, emotional wellness, and financial support. I didn't pick out everything because, but these are the things I remember you talking about. So the legal issues, of course, because people want justice. The wellness issues, because people need counseling, and possibly also to do with healthcare, access to healthcare as well. Financial support, partly because you are suggesting that some of these victims are people who are financially in a difficult position, and and it's possible that financial aid will, at least access to it, will increase the number of reports. There is a connection to finance. That's why I put it there. But I remember you talking about it. Other things you may have talked about that I haven't put here would be to on issues on education. I think, how do you educate? I don't know if we should include it here. I'm trying to simplify the form, so I picked the most important ones. There's another issue. I've forgotten it now. Okay, the key outcome of this is enhanced accessibility to support networks and education. And then, of course, the prototype format are these. The user action. To track users, click on support resources for legal, emotional, and financial well-being. So that has to be done in a way that they can click on that intuitively. And then the follow-up survey is going to ask the following questions. These are the questions. Did the resources meet your immediate needs? Now, this is just general, but by resources, what we mean is the legal support, the healthcare support, and financial support, and any other support that we might want to include in that. Those are the resources. So did they meet your needs? And give them a chance to say, no, I needed this, so that we can get what they're saying. It's part of the needs assessment. Was the information easy to understand? So there are legal questions. We have to break them down because the legal system requires certain questions answered. Yeah, police was the other one. The police itself also needs certain questions to be asked and answered. So we have to break it down and make it simple and short so people don't feel it's overwhelming. And then, did you feel confident in using the resources provided? Okay, so the questions cannot be either technical or even legalistic or intimidating, so that the people are feeling comfortable answering the questions, something like that. And so these are this information, when it comes, will give us a sense on how we need to design the form. Under engagement, we're going to ask these questions. There's three. How do you feel about accessibility of these resources? In other words, we're testing to see whether they're okay being asked these questions. Sometimes people don't want to be asked. What could be improved about the support service? Now, these are the ideas on improving what we're saying. And then it's emotional, a lot of that. And did you feel your needs were being heard and understood? Again, I'm getting this from you because you're often saying people are not listening. And this is the listening question. Do you feel people that were listening to you? Something like that. Now, the information that's being sold to, let's say, NGOs and UN type organizations is we track which resources are most accessed and preferred, either healthcare, maybe justice, like legal services, maybe police, or maybe it's financial. And then this one, understanding the barriers to accessing support services. So this is information we'll have by way of data, the barriers to accessing support services, all these that we have said. And then we'll evaluate how well resources meet the needs of the survivors. Okay, so we'll be able to rank them, which ones meet which needs and to what extent. And this could be information that we can make available for people who are interested. Of course, we don't reveal anyone's names. So the third objective, this one now is dealing with partners. Partners who are paying are very interested in objective number 3, to create sustained engagement with reporting support services to ensure long-term recovery and employment. This long-term word is key, but what we really mean is that even after it's done, these people can use our system as evangelists on one hand, but also as you can say, people who can help victims, because these are survivors, who can help victims in meaningful ways, in contextual ways, because a lot of this is cultural and some of it is situational. So victims are very strategic in helping other victims, at least survivors, strategic in helping victims to report successfully. So that humanizes the process. So the outcome, the key outcome here is improved consistency in victims utilizing resources for continued recovery and empowerment. And now the prototype format, again, we have the user action and the survey. Let's look at the questions. The first question on ongoing engagement. Do you feel the reminders are helpful in helping you to track? So when you report the first time, we will remind you to come back and track the progress of various things. Like supposing you have a series of appointments that you have with your counselor, that's a reminder issue. Supposing the police require you to come back with evidence of some kind, maybe with your ID or something, that's a reminder. So we will have to break it down so that they can understand it well enough to answer this question. And then, what additional support would you find useful for the recovery journey? Okay, if we're dealing with survivors, they might have stories to tell us, but we'll see. Would you prefer fewer reminders? Yeah, because there can be many, but if there are other questions, you can also just inform me. And then this one of resource utilization. These are questions. Have you noticed improvements in your situation after using the resources? So we'll give them access to the resources in the test. And once they've gone through it, we can ask this question. How confident are you that resources will continue to support your recovery? All right. Resources are not only having a chance for you to report, but they give you this chance to follow through, follow up, and then give you a chance for feedback. So you get feedback like the government has said this, the police are saying this, the courts are saying this. You're getting that feedback. And then, of course, once you're done, you interact with the community of survivors. So all this helps to build your confidence of using these resources. So are there any obstacles preventing you from utilizing these services more regularly? They can tell us. This is just part of needs assessment. So we're trying to find out what are their needs. Now, the data we have, which we'll sell to people who help us, who are our partners, is measure long-term engagement with services. Now, long-term is good because we can always say these people are hanging around even after the abuse has taken place. When we measure long-term engagement with services, we're also measuring the time, how long they'll stay. And then on the system. And then understand the factors that influence sustained use. This is important if we're going to be useful to the survivors. What are the factors that influence their continued usage? You see, they'll tell us, and then we will try to play to that. And then here we have identify gaps in long-term recovery support. Yeah, so these gaps will emerge, I think. We'll see them, but we have to identify them so that we can include it in the iterations of building the solution. And then the last one is this one. This one is use anonymized reporting data to inform impactful policy changes and preventative measures. So this goes to the government and international organizations that are interested in policy and they need data to inform their policy. So the outcome of this is data-driven insights to shape societal and governmental responses to abuse. Okay, so this one's quite clear. Again, it has its user action and follow-up survey, but we'll look at the prototype format, which we have to build. These are the questions we'll be asking once we have the prototype. They'll use the prototype, then they'll answer this. Do you believe, these are again victims who are answering. All these are being answered by victims, not by anyone else, or survivors. It might be easier to get survivors than to get victims. So do you believe your report will lead to a positive change? We're asking this to survivors. How confident are you in the system's ability to prevent your anonymity, which means to keep your privacy? We have to reword these so that they are more understandable to survivors. And was the reporting process simple enough for you to provide useful data? Okay, so that's an important question. And then how helpful, this is now under data usage. and be looking at how it can influence the policy. How can the policy influence feedback system? We're looking at that, the policy influence feedback. So, how helpful was the data provided in shaping your policy decisions? This is this is not policy. This is your decisions. Do you feel the anonymized data reflects the true scope of the issue? And what additional data would make your policy development more effective? Again, here, not policy, but just your decision more effective. Okay. Now, the data we're gathering is to collect anonymized reporting data to measure how well data aligns with policy goals and actionable insights, and then identify gaps in data on or reporting methods that could improve policy development. Now, you see, this is not possible only from user data. We have to know which government agencies are interested in this data, which international organizations are interested, and exactly what they're interested in. And then we align what we are collecting here with them. And then now this becomes interesting because we will be looking at what aligns with their policies and the actionable insights. And also we'll identify gaps, but we'll also look at whether the anonymized reporting data is somehow aligned to what they are interested in their policies. I mean, because policy, even this data privacy, cyber security, and all these things, they're very much controlled by policy. So we have to see how our own anonymized reporting system aligns with the existing policy. So that's the end. That's now what we're producing. And you see, this prototype has two aspects. It has what I'm calling the I'm calling it this I'm calling it the prototype format, which is the screens they click through. And then we have the survey itself. This is the survey. And the survey asks them questions having clicked through the prototype. You see? And in total, I may have to reduce them, but in total, I have 24 questions. What we've gone through are 24 questions. So they'll click through 24 screens and they'll answer 3 questions per screen. They're not 24. They'll click through 8 screens and answer 3 questions per screen, something like that. So that's it, Jackie. What do you say? I'll open it up to you now.
Okay, it's making sense now.
Yeah.
That's, I don't know, maybe that's a good place to start.
Yeah.
And I think if we have it as a prototype, at least it can get us the information we need. But now my question is, because you began with a needs assessment.
Yeah.
So does this prototype are we going to use this prototype to get the needs assessment
Yeah.
data? Because I think the needs assessment you're talking, you remember you asked me to do a needs as proof of something, proof of concept.
Mm.
You told me to get research, like written materials that there is actually a problem. So there is the primary side of it, the secondary data. That's secondary data. So we need to go to the ground
Yeah.
and ascertain.
Yeah.
So this prototype is what you are going to use to go to the ground.
No. So there are two things. We have what we can call survivors of domestic violence. We need to identify some. Let's just say we get 20 of them. We're going to take them into a room. I'm just using it as an example. It doesn't have to be this way, but we take them into a room and then we enter into the room with the prototype. And then we show them how to use the prototype. It's just a matter of screens, 8 of them. So you click here, the screen opens, then they follow the instructions on the screen. Of course, they're written, it's done in a very straightforward way. So they'll know, click here, click. When they're done, we ask them 3 questions for each screen. So they go through 1, then 2, then 3, and each time you open the screens, you click through them, you answer 3 questions. You open another screen, you click through them, you answer. We do that 8 times. And once it's done, it's done. That's the test, Kusha. And we're doing it with, let's say, with 20 people. Now, those are survivors. Okay. Now, the feedback we get will be analyzed using analytical software we have. So that will become the assessment of the. So the data itself informs the need assessment. There's a link between the data that we collect from that exercise and the need assessment. The need assessment is simply assessing their need. So when they're answering these questions, we'll know their need because that's the question we're asking. What is your need? But in different ways. And once we've done that, we've got it, the data. Then we move to the analysis of it. We have to analyze it. Once we analyze it, then we have a report that speaks to the needs assessment. But the analysis is what? The analysis is now what you're saying, is that you got to go to the secondary data, and there are three categories of secondary data you need to investigate. The one of the survivors, we already have collected from real survivors. So that's okay. But the three categories we need are service providers. These are police, hospitals, lawyers. Maybe you could add another one, but you see, those are service providers. The second is government. These are government agencies, maybe departments in the Ministry of Gender, and there could be others. And also include governmental organizations like, you know, these women's organizations and UN type organizations, because they all have policy. So that's the second type. You need to get secondary data from them. Then you need to get secondary data from the third type, which is partners. Partners are people who are willing to pay for this data, or they're willing to pay for that activity. For example, if we're saying we're doing this kind of service to girls, teenage girls, for example, and this could be in low-income neighborhoods, you might find that there are partners who will come in with us and say, well, if you're doing it in low-income neighborhoods and you're talking of girls of 13 to 19, we'll fund that. You see, now in a different scenario, you might find that people are doing it for communities in a particular county. So the county itself is saying, if you're tracking domestic violence in our county, we'll give you support for that. You see, those are partners. So we need to again scout around the secondary data again to see that category, and we need to list them. But we're not just listing the partner, we're also interested in what they will fund. What is it exactly that you will fund? Because we need to align all that data, like let's say the partner's data, to the need. Now that's an exercise of alignment. We just see, oh, okay, so you guys are interested in supporting our reporting system. Yes, okay. So we're reporting in these specific ways. Now we can see your need and what you want for us to what you're willing to fund fits into this particular need, which we're actually providing as a service, as a solution to our victims. So that mapping exercise is what we will do, and that is the final report we'll produce. It will show how we are mapping our needs to the stakeholder environment, the service providers, the governmental organizations who are doing policy, and you can say partners who are willing to fund what we're doing. You see, because they want that data, so we'll give them, no problem. So that alignment. So that's now what you need to do. So if you can work with these three categories and identify the names, you've got to get detailed information of who we are talking about, all of them. And then what is their need that they will fund, or what is their need that they want to write policy around? Maybe there's a policy gap and they don't have information in reporting of domestic abuse. So what is their need there? And then with the ones who are providing services, what is the service that they want to provide? You see, in what way do they want to do it? So that we can now align what they want with what we're saying is the need on the ground for end users, survivors, or even for victims. Yeah. So if you can get that data, that is good, because once you have that data, I'll build the system. The next week I'll have built the system. Then I'll show you. It's a proof of concept. So it's a very basic system. I'll build that one. Then I'll show it to you. and you'll be able to use it. You'll see the clicking, the screens I'm talking about, there'll be 8. You click on this screen, 1, 2, 3. Then once you're done that, you'll be asked 3 questions. And then you'll go through the whole thing. We can modify those questions, we can modify those screens, because we have to work iteratively until we have something that we feel this is a good proof of concept. Because once we have this information, it will be helpful in terms of meeting the need to report in the ways that we are saying, in a way that is private, in a way that is simplified, in a way that is, you can say, within the culture of the people who are reporting, not in an alienized way, but in a way that is consistent with the expectations of the victim. So that we'll be able to have, and we'll go back and forth until it comes out nicely. But by next week when I'm presenting, I'll present the prototype itself, so that you can weigh in on it. Now, that prototype is only going to capture end user data. That's survivors data. So we need to map that to the stakeholder environment that I was talking about. So that's what you need to get from secondary data. I hope it makes sense, Jackie.
It does.
Yeah.
It makes sense.
Hmm.
So from my end,
Yes.
I should get you the list
Yeah.
for say potential stakeholders and potential partners.
Absolutely. Yes.
And then, so when I get the list, should I go ahead and call them and ask them, or I just get the list first?
Now get the list, and let's just be clear. There are 3 categories. So there's the what we're saying, service providers, partners, and governmental organizations. Those are the 3 categories. Okay. So if you got that, that's good. The list we need is their contact details, which must have, let's say it's a government, it must have the department, the section, and then the project name. Because when you're writing these reports, you cannot be general. You have to be very, very specific. We have to get that project name. And sometimes they have more than one project. So it's not one. If there are 2 or 3, we capture that. Sometimes it's down to the activities within a project. So they'll tell us, in this project, there are these 3 activities. Okay, we capture that. And then this other project, the activities which require this, and we capture that. So that is, it's you get that. Once you get that, that's very, very crucial information. Then we need a contact person. We need, because this is, because we have to engage them in our tests. We'll be also testing them down the road. So we need to get a contact person, of someone you could say who will give us access. Not just anyone, but someone who will give us access. So that if let's say we need to get the permanent secretary, but we can't really get the permanent secretary's details, but we can get their personal assistant. So let's have that one as our contact person so that we can access. Okay, so once you have that, so that's one. Then if you do that and you have a list which is, I don't know, comprehensive, we're in business. Because you see, investors like to see the government involved in a serious way. I mean, they have to be convinced that the government's involved and they're interested in this. So that helps with investors. And with government, they want to see that these stakeholders, like social services providers, like hospitals and police, and you can say NGOs, they want to see that on the ground people are involved. Mm. And when they see that, then government is interested. When investors see government is interested, then they want to invest. So that is a kind of chain that we have to have names and lists. Government like numbers, because government's very political. So when you start saying hospitals, so we're saying we have to identify an area. If we're saying we're going to start, for example, in Eastlands, then we need to map out the area we're talking about. Because as long as within there we have the police community, we have the clinics, the hospitals, we have the names of counselors, for example, we have um, lawyers, we have within that area. So if we can cover a good area properly, then we can tell government, you see, we've done for Eastlands, we can do for Westlands, we can do for Langata, we can do for all other locations within Nairobi, you see. But we just need to cover one location in Nairobi, even one area. It doesn't have to be a whole location. We do all our tests for that, and then we tell them once this is successful, we'll scale to every other location in the whole country. You see, now it's convincing to government because we've done it with that one successfully. Yeah.
Okay.
Yeah. How are you
I
feeling
have
today?
nothing.
You have a cough, I'm hearing. Is it the sickness?
I have tonsils, I have a cough,
Mm.
I just have everything.
Yeah, probably about that. It seems you're stressed. You could also be stressed. You know, when you're
But
under,
the worst is over.
yeah, but stress, let me tell you, is the biggest, it reduces your immune system. So you become more susceptible to these opportunistic diseases or even dust. You can become more prone to being infected by dust. But it's good you're recovering.
Yeah, it's good I'm recovering because I
Yeah.
it was hard. You know, Troy doesn't understand when I'm sick.